Carrie,
Yes.
this is Maria. The system kicked me out, so my apologies.
Hello?
Now everyone can hear you, so you may need to start again.
Okay, great. So we're all right?
Can you guys hear me? This is late.
Yes.
Okay.
Yeah,
Yes.
we're back up. Okay, great. And you're recording?
Yes.
Well, good afternoon, everyone, and welcome to today's webinar, Getting Answers About Concussions, CDC to Pilot a National Concussion Surveillance System. This webinar is offered by the National Association of State Head Injury Administrators. I'm Carrie Bennett, Chair of NASHIA's Training and Education Committee. Thank you so much for joining us today. If you're unfamiliar with NASHIA, we are a nonprofit organization created to assist state government in promoting partnerships and building systems to meet the needs of individuals with brain injury and their families. Before we begin, I have just a few housekeeping details. A GoToWebinar user guide is available for download from the NASHIA website. This is a great resource for making the most of your webinar experience. An online GoToWebinar help button should also be visible at the top of your attendee control panel. For technical assistance, you may also call either of the numbers listed here. To control for background noise, all attendees' microphones will be muted during the presentation. However, you may submit questions for the presenter at any time by typing and submitting them in the question text box on your GoToWebinar toolbar. Any questions that are not answered during today's webinar will be answered later via email. Please watch for an evaluation of today's presentation at the end of the webinar, and we welcome and appreciate your feedback. Also, slides from today's will be available at the NASHIA website next week. Our objectives today are to explain how TBI surveillance is currently captured and to understand its limitations, identify the goals of the pilot system, and to map how this data might be useful to you. Before we begin, we have just a couple of poll questions for our audience. Please respond. Is your state collecting information specifically relating to sports-related concussions? Please select yes or no. So it looks almost evenly distributed. Several states indicate that they are collecting state information regarding sports-related concussions, but several of you aren't. Question number 2, is your state collecting information related to concussions regardless of the cause? And it looks very evenly distributed this time. Half of you indicated you are, and half of you indicated that you're not. Thank you so much for responding. And now I'm so pleased to introduce our speaker, DePadilla. Lace is a behavioral scientist on the traumatic brain injury team in the National Center for Injury Prevention and Control at the Centers for Disease Control and Prevention. She is currently the project lead for the TBI Surveillance System project. And Lace, take it away.
Okay. Does everything look all right?
Yes.
Okay, great. Well, thank you so much for the introduction. As stated, I'm going to be discussing CDC's plans to pilot a national concussion surveillance system. To review, during this webinar, we will be providing the background for the project, including the limitations of the data sources about TBI that are currently available. We will also be laying out the goals for the pilot and for the surveillance system more generally. Finally, through the discussion, we hope to show how the system may be useful to you. Here is an overview of the presentation. We will be covering what we hope to accomplish and how we hope to accomplish it. This will include a detailed discussion of the purpose and the methodology for the system and how the pilot fits into that process. We will discuss the timeline for the project, including the current preparatory phase and our plans for implementation of the pilot. We'll also highlight what the survey will cover and delve into specifics to help make the purpose of the system more accessible. Through this process, we can begin to think about potential uses of the data. This will lead to a discussion of the benefits of the system. Here is an overview of the public health approach to prevention. Surveillance is an essential building block in the public health approach. It can enable us to establish the extent of the problem and the characteristics of the population who are experiencing the problem. We can learn more about their experiences and the potential consequences of the problem. Surveillance can be the first step in identifying risk and protective factors that lead to intervention development. On the screen now is a definition of surveillance. Surveillance entails the regular, ongoing collection and analysis of health-related data for the purpose of monitoring the frequency of the occurrence and the distribution of a health condition in the population. In this case, we are interested in the health condition of TBI. Specifically, we would like to better understand the behaviors within the population when a TBI occurs. We are seeking to thoroughly describe the occurrence of the problem. Although surveillance generally does not include hypothesis testing, surveillance systems can often be hypothesis generating. Through this, we assess the need for intervention and measure the effects of interventions when data is collected in the population over time. We seek to create the ability to make informed decisions through accurate and timely evidence. This makes the integration of dissemination with collection and analysis essential. I'm going to describe 3 of the systems currently used for TBI surveillance. Each has strengths and weaknesses. One is healthcare-based, and it collects information about non-fatal injuries and poisonings treated in U.S. hospital emergency departments. It's called the National Electronic Injury Surveillance System All-Injury Program, or NICE for short. We'll talk more about this on the next slide. The other 2 systems collect data through athletic programs, and as you might expect, include information about sports-related injuries. There's the NCAA Injury Surveillance Program and reporting information on a specific healthcare system or statewide surveys. This source of data is co-sponsored by the CDC and the Consumer Product Safety Commission. As I mentioned, the system captures all injury-related emergency department visits, even those that are unrelated to consumer products. It is nationally representative and can be used to identify mechanisms for TBI, such as sports and recreation-related injuries. However, there are important limitations of these data. Using this information, we will miss those who have more serious non-brain injuries because the information only includes the principal diagnosis and the primary body part injured. By looking to emergency department data, we will also miss those treated in other settings and those who did not seek care. On the screen, we show the limitation of small sample sizes for certain subgroups. An example of this would be comparing females who experienced sports or recreation-related TBI across 2 classifications, those who were treated and released, and those who were hospitalized or transferred to another facility. In this example, less than 10% were hospitalized or transferred to another facility. And comparing information, the group is so small, because any estimates produced are unstable. Finally, there is no information on risk or protective factors available from these data. The next two slides discuss data collected through athletic organizations. These data sources allow for rich data about specific mechanisms of injury related to organized sports. But in the case of the NCAA Injury Surveillance Program, the data are limited to participants in collegiate sports. Similarly, high school reporting information online is limited to participants in high school sports who attend schools that have certified athletics trainers. Both of these data sources are limited to sports-related injury, and neither collect data about kids who are younger than high school aged. It's also important to note that both are limited to school-based organized sports. We lose information about non-school-based organized sports or recreation that takes place outside of any type of league. Here is the specific recommendation from the Institute of Medicine that was the impetus for a national surveillance system for concussion. What I'd like to highlight here is, although the initial focus may have been on sports-related concussions in youth, the system as designed from the beginning will be able to provide a much wider range of information about TBI. I'd like to now walk you through the goals of the system that relate to the IOM report, and then expand to the broader perspective that was taken in the development of the system. These are the goals set forth by the IOM. National incidence estimates of sports-related concussions in youth. The ability to compare organized sports versus non-organized sports versus recreational activities. Through the surveillance system, we will be able to go beyond the limitation of the sources of data that I mentioned earlier. We will be able to report about injuries among youth who are younger than high school aged. We will also be able to report on activities that occur in the context of organized recreational leagues or non-organized activities, such as bicycling or pickup games. As mentioned earlier, the way we have developed our methodology enables us to provide additional valuable information. The broader goals of the system include national incident estimates of TBI overall, national estimates of TBI-related disability, and a comprehensive picture of healthcare utilization patterns for TBI. Again, using the surveillance system, we will go beyond the emergency department data that I mentioned earlier. We will be able to report on injuries that are not reported to the emergency department. For example, we will capture people who seek care for their TBI at urgent care clinics or parents who seek care for their child's TBI at their pediatrician. We will also be able to report about people who do not seek care. Additionally, regardless of where people do or do not seek care, we will be able to report the same level of detail about the injury. On the next slide, I will talk about our methodology in order to explain how we will accomplish this. Here are the advantages and limitations of our methodology. We will be randomly selecting households in order to collect data from a nationally representative sample of children and adults. I'd like to walk you through how that will work. We will randomly select an adult in each household that we contact. That adult will be asked to report about their own history of TBI. If there are children in the home, we will ask about the best reporter to complete an interview on behalf of their children. We will be randomly selecting children in the household, and then the best reporter will be asked to complete interviews on behalf of their child or their children. We will be asking about TBIs experienced in the last 12 months, as well as TBIs experienced in their lifetime or in their children's lifetime. While the system includes the advantages described, there are important limitations. We rely on self-report and parents reporting on behalf of their children. There is also the reality of declining response rates in random digit dial collections. Now, I'd like to walk you through what has been done for the project, what we are currently working on, and the timeline for the rest of the activities necessary to develop a surveillance system. In advance of developing our methodology, we needed to know what systems were already in place. I have shared some of that information earlier in this presentation. After consulting with surveillance experts, as described on the previous slide, we opted for a household survey that would utilize random digit dial. As I mentioned, there are some challenges associated with random digit dial, and it is important to note that we are keeping abreast of changes to the surveillance landscape given changing phone use patterns and response rates for random digit dial surveys. Piloting the system will be an important and informative step from this perspective. Here are our current tasks. We are in the midst of finalizing the survey. We have, in this process, spoken with a range of experts and partners who work with or advocate for adults and children who have experienced a TBI. The next step will be to cognitively test the survey for clarity of wording, understanding, ease of recall, and to assess the perceived burden of the survey. Through this process, interviewees will be able to experience the flow of the questionnaire and provide feedback about modifying questionnaire items for improved clarity. We are also in the process of finalizing the sampling plan and the screening process. Overall implementation plan. Once the implementation plan for the pilot is finished, we will submit our study for review to the Office of Management and Budget. Once it is approved, we can move forward with conducting the pilot. After the pilot data is collected, there will be a period of preparing the data for analysis. Data from the pilot will inform how best to stand up a national surveillance system for TBI. In order for the surveillance system to be effective, we need an estimate of how many people experience TBIs within a 12-month period and information about how many people we need to contact in order to have meaningful data for analysis. In addition to having a better idea of the numbers of people reporting TBI through such a system, we will also learn additional information about our questions and the response categories for those questions. Applying will strengthen the survey and therefore the information we collect. Here is a timeline of our project. The first square, titled Pilot Preparation, is slated to occur between 2015 and 2016. This is where we are currently in the process. The second square, titled Pilot Begins 2017, is describing what our plan is for the next year. We anticipate collecting the pilot data in 2017. As noted here, we plan to collect data for 1 year in order to account for injuries that may be more likely to happen in different seasons. The last square describes how, when the pilot is complete and the data is analyzed, we will be ready to launch a national scale system. To look into the future, as noted on the last square on the previous slide, once the system is in place, we will be able to analyze trends over time and we'll have evidence of whether our prevention efforts are effective. And once enough data is collected, we'll be able to provide state-specific information. This will require combining multiple years of data due to sample size. We will need more than 1 year to provide estimates at the state level because of sample size and the incidence of TBI. We would need enough information for each state to have stable estimates. What we are showing here is a high-level description of the questions that I will now describe. Afterwards, I will describe specific sections in more detail. When describing questions, I will refer to the respondent, and when applicable, this could be the adult or the adult on behalf of their child. The first section is demographics, health information. For both parents, and their children, we will be asking basic demographics such as age, education, and insurance. For youth, we will also ask about general health and comorbidities. These comorbidities include epilepsy, ADD or ADHD, migraines, developmental delay, or conduct problems. We will want to establish whether the child was experiencing the condition prior to any head or neck injury we discussed that occurred in the last 12 months. We will then ask parents about their own physical activity or their child's physical activity over the past 12 months. Physical activity could include activities for fitness and fun, such as playing a sport, including non-organized sports such as pickup basketball, exercising, or riding a bike. We ask, on average, how many days per week and how many minutes on an average day. Then we'll be asking about head or neck injuries experienced in the last 12 months. The first prompt is whether the respondent or their child sought care for a head or neck injury, or if they or their child were examined because of an injury to the head or neck. If not, we will probe for head or neck injuries that may have been experienced during a car crash, while playing sports, or engaging in recreational activities, or other mechanisms, such as falls. We will be asking about the month of the injury in order to place it in the season in which it occurred. For youth, we will want to know if they were at school at the time of the injury. If there was more than one injury, we will ask about the injuries in order of severity. The next section is symptomatology. We will ask about signs and symptoms. In this set of questions, we are careful to make clear that we want to know about things caused by the injury or things made worse by the injury. These include being dazed, stunned, confused, or disoriented, not remembering events before or after the injury, and loss of consciousness. Additionally, we ask about nausea, headaches, feeling dizzy or uncoordinated, blurred or double vision, or having trouble paying attention. We also ask about difficulty thinking clearly or remembering new things, sensitivity to light or noise, changes in personality or mood, and changes in sleep. It is important to note that the wording of the questions has been adjusted to consider whether it is an adult answering on behalf of themselves or if it is an adult answering on behalf of their child. We will also be asking about how long it took for those symptoms to be experienced. Was it immediately or within a few minutes, or did it take hours or days? We then want to know how long it took for all symptoms to resolve. After collecting this information, we will be able to apply a case definition. This involves grouping reported symptoms and time to onset to assess a level of certainty that a TBI was experienced. Although we have not completely decided on our naming convention, a way to think about this is as follows. Using these symptoms, potential concussive events will be categorized as possible, probable, or more definitive, depending upon the symptoms experienced and their temporal association to the event. For example, someone who had headaches, blurred or double vision, or sensitivity to light or noise hours to days after the event would be considered to have a possible concussion. On the other hand, someone who was knocked out or lost consciousness for any amount of time at the incident would be considered to more definitively have had a concussion. Should the case definition be met, the next few sections will also be asked of the respondent. For the purpose of the pilot, a respondent will only need to respond affirmatively to one symptom question in order to advance to these next few sections. The first section is injury mechanism. Here, we'll be asking about the setting of the injury, whether it's falls, military service, motor vehicle related, sports, physical fitness, or recreation related, or perhaps unintentional self-harm or harm by another person. The next section is medical services received. Ask about their initial evaluation, any other evaluation, hospitalization, or inpatient rehabilitation. After asking about medical services received following the injury, we will ask about three important post-injury topics: returning to work, returning to school, and returning to play. Each Even if the case definition was not met, these last two sections on your screen will be asked of the respondent. The first is lifetime TBI. Here, we are interested in TBIs that were diagnosed as well as TBIs that were not diagnosed. Additionally, we have a section about disability, and this section will only be asked of adults. We'll ask about currently experienced disabilities and ask if they are in relation to a head or neck injury. Now, I'd like to go into more detail about several sections I described at a high level on the previous slide. Again, when applicable, respondent refers to the adult or the adult on behalf of their child. First, I'd like to talk more about the mechanisms. The first thing we'll be asking about is the location. Was it inside or outside? Was it in the home? Was it on the street? Was it someplace different? If the location where the injury took place was a school, we will ask if a school nurse was available to provide care on the day of the injury. For adults, we will want to know if they were working when the injury occurred. Now, I'd like to provide an example of how we will ask about broad mechanisms. For injuries that occurred during military service, we will ask about the specific setting. For example, was the respondent deployed to a combat zone during combat operations, or were they deployed to a combat zone but not during combat operations? It could have been military training or while off duty. We will also ask if the injury occurred during a blast or an explosion. If the injury did not occur during a blast or explosion, we'll continue on through the mechanism section, including bikes, motor vehicles, and sports and recreation related activities, so that we can provide more context for a military service injury. To give you an example of conditions, for bike or motor vehicle related TBI, we will ask about the condition of the road or path at the time of the injury. For bikes, we will want to know specifically what the bicyclist collided with when they experienced and whether they were moving or stationary. We'll be interested to know how the bicycle fell off the bike. Was it over the handlebars? Was it to the side or off the back? Also, we'll want to know where the injury took place. For example, was it on a street? And if so, was there a bike lane? The injury could have taken place on something other than a street, such as a bike path, a dirt trail, or other off-road track. We are also interested in whether the respondent was riding the bike primarily for transportation or if it was for a recreation-related reason. For motor vehicles, we'll want to know if the respondent was the driver or the passenger, and if they were wearing a seatbelt at the time. We'll also be interested in the type of vehicle, as in was it a car, a golf cart, a motorcycle, or a bus or truck. Similar to injuries among bicyclists, we'll want to know where the injury occurred. Was it a private or public street? Was it a dedicated motor vehicle track or a dirt trail? Additionally, we'll want to know whether the collision was with another motor vehicle, a stationary object, or perhaps an animal such as a deer. For sports and recreation activities, we will ask if the respondent experienced an injury while playing a sport or while engaged in physical fitness or recreation activity for fun or competition. Regardless of type of sport, we are interested in knowing what initially caused the head injury. This could be, for example, contact with another person, contact with a surface, or contact with a playing apparatus. Now I'd like to provide you with a couple of sports and recreation examples. For cheerleading, we would want to know what the surface was. Was it grass, asphalt track, or perhaps a mat? We would want to know the specific activity. In this case, it could have been a stunt, a toss, or a pyramid, among others. We also want to know what the specific position the child was in at the time of the injury. And in the case of cheerleading, some examples are a base, a flyer, or a tumbler. If it was softball, the respondent or their child was playing fast pitch or slow pitch at the time of the injury. For baseball or softball, we will be interested to know if the injury was caused because the respondent was struck by an object. If it was, what was the object? It could have been a bat or perhaps a batted ball or something else. Also, what position was the respondent or their child playing at the time of the injury? They could have been a batter, a base runner, a pitcher, a catcher. Across organized sports, we'll want to know if medical personnel or an athletic trainer were available to provide care on the day of the injury. We'll also be if the injury occurred during practice, competition, or performance. Another type of mechanism we would ask about is falls. If the injury occurred due to a fall, specifically we'll want to know, was it from the floor or from ground level, like a trip or slip? Was it down the stairs? Or was it from a height less than or equal to 10 feet? Or was it from a height greater than 10 feet? Mechanisms in the survey, I want to highlight that even if a respondent reports TBIs for which they sought care, we will still think about other head or neck injuries for which they may not have sought care, related to falls, military, motor vehicles, bicycles, sports, physical fitness. The first post-injury section I'd like to talk about is their healthcare interactions after the injury. Who, when, and where. Specifically, who first looked at or examined the respondent. Some examples would be a nurse, a doctor, an athletic trainer, or perhaps emergency medical services. We'll want to know when this initial examination took place. How long after the injury were they first evaluated? Was it at the time and place of the injury, within 24 hours, within a week, or was it more than 1 week later? We'll want to know where the first evaluation took place. Was it their regular doctor or primary care physician? Was it an urgent care clinic, or perhaps a sports medicine clinic? It could also have been an emergency room or an outpatient clinic in a hospital or some other location in a hospital. For military respondents, we'll also ask about receiving care through the Department of Veterans Affairs. After establishing where the respondent initially sought care, we'll ask about other places they sought care afterwards. This will help provide a more complete picture of healthcare. If the respondent did not seek care, we will ask why. For example, was it because they did not have health insurance, have transportation? Perhaps they couldn't have authorization from their insurance. Maybe they couldn't take time off work, or maybe if they did seek care, we'll want to know a few more details about that. Did the respondent stay in a hospital overnight or longer because of the injury? If so, how many nights did they stay in the hospital because of the injury? After discharge, did they receive inpatient rehabilitation care for this brain injury? Up until now, we've not asked about a formal diagnosis. Now that we have established that care was sought, we'll ask if a medical professional diagnosed the respondent or their child with a concussion or brain injury. We'll also ask if they received additional services and if they are still receiving services. While medical follow-up is an important part of post-injury evaluation, we are also interested in when respondents are able to return to their previous activities. Specifically, we are interested in work, school, and play. It is of note that recent policies reflect the importance of ensuring that students who have sustained concussions have thoroughly before re-engaging in athletic or academic activities. To date, all 50 states and the District of Columbia have enacted laws addressing youth sports concussions and returning to play. 7 states have also incorporated language around returning to learn. Now I'm going to highlight return to work. Did the injury cause the respondent to miss or stop work? Have they resumed work? How long were they off work? If they are still off work, how long have they been off work? And did the injury cause them to miss or stop other responsibilities, such as taking care of their family or doing volunteer your work? And if so, now I'll highlight return to school. We'll want to know, did the child miss any schools due to the injury? If so, how many days did they miss? What was the communication like between the healthcare provider and the school, as well as within the school? Did their child's healthcare provider make any recommendations about returning to school? And were these recommendations shared with the school? Were the child's teachers told about the child's injury? Did the child receive extra help, support, or services at school due to the injury? If so, what extra help, support, or services did they receive at school? Things could be tutoring in the classroom or additional time for assignments, projects, or tests, perhaps a written plan or 504 plan, possibly counseling, or attending school for partial days, or maybe audiobooks. For how long did they receive this help? And did their child receive all of the help, support, and services at school that he or she needed related to the injury? We are also interested in how the child's academic performance did. We'll ask if their child's grades have declined since the injury, and if so, do they believe the decline in grades is due to the injury? If the child's grades have not declined since the injury, is the child having to work harder for the grades they had prior to the injury? Now I'll highlight return to play. We are interested in knowing if the respondent or their child was removed from the game, performance, or practice as a result of the injury. We will want to know who removed them. Examples include a doctor, a coach, or perhaps they removed themselves from play. We'll ask if they've returned to full sports and recreation activity following the injury, and if so, when did they return to full sports and recreation following the injury? We'll also ask who made the decision to allow them to return to play. It could have been a doctor, an athletic trainer, an EMT, a parent, maybe an official or a referee, or perhaps they decided to return themselves to play. If it was a doctor who returned to play, what kind of doctor made the decision for them to return? Was it a primary care provider? Was it a sports medicine physician? Or perhaps a neuropsychologist? Among adults only, we will be asking a series of questions about disabilities. We want to know what disabilities the respondent is currently experiencing. These disabilities or having serious difficulty hearing, experiencing blindness or difficulty seeing, even when wearing glasses or contacts, having a physical, mental, or emotional condition that results in serious difficulty concentrating, remembering, or making decisions, experiencing serious difficulty walking or climbing stairs, having difficulty dressing or bathing, experiencing physical, mental, or emotional conditions that result in having difficulty doing errands alone, such as visiting a doctor's office or shopping. It could also include being unable to work because of a physical, mental, or emotional condition. We are interested in knowing if the difficulties experienced are the result of a head or neck injury, and if these difficulties were made worse by a head or neck injury. Now I'd like to talk through benefits of the system. Understanding what populations are most impacted can help us to know how to allocate resources. The data sources are likely to underestimate the burden of TBI. As stated previously, once the full-scale system is in place, we will be able to provide national incidence estimates of TBI overall. We will also be able to provide disability for the first time ever. Additionally, we will be able to provide national incidence estimates of sports-related concussions in youth, including youth who are not yet in high school. In this same vein, we will be able to compare injuries experienced in school-based or non-school-based organized sports and recreational activities. Also of interest is the ability to examine healthcare utilization patterns. Once the system is in place over time, we will be able to monitor trends in TBI, assess whether prevention efforts are working, and also, over time, we will be able to provide specific state information which will likely require combining multiple years of data. We will also be able to see if healthcare utilization patterns change over time. Understanding the circumstances of the injury will shed light on what aspects of different mechanisms might be appropriate targets for intervention. We plan to collect detailed information specific to each mechanism, including seatbelt use, helmet use, the presence of bike lanes, the surface on which the activity occurred, and, where relevant, the distinct activity the respondent was participating at the time of their injury. We will discuss why people who report injuries and symptoms that are concussions don't seek care. This will also inform intervention efforts. Knowing from whom people are seeking care can help us understand which doctors or specialists are most sought after for treatment and identify any clinical training needs. Knowing what kind of care was received, such as inpatient rehabilitation, will provide additional data about what mechanisms are reported when this kind of care is received. Patterns related to returning to work will clarify the impact of TBI on the ability to work and how long it takes to return. Return to play information can help us to understand if people are returning to play fully resolved and if they are in compliance with return to play legislation. Return to learn details will help us develop an understanding of the communication experience of the TBI and if they receive all of the help that they need. TBI is a problem for the young and the old. It is a problem that can be life-changing. The methodology we are employing will allow us to capture concussions that are missed by current surveillance systems. Specifically, it will allow us to capture concussions that are not captured by current healthcare-based data sources and the current data sources focused only on organized sports. And this is in an effort to understand the true burden of TBI. Thanks so much for listening today, and here is my contact information. And now I think we have time for questions.
Yes, we do, and you have there are 4 or 5 questions on here, so I'll just read through those for you. The first one is from Sandra Williams. Sandra asks, is this system going to include identification supports for schools to target the larger contributor from car accidents and falls?
Identification support for schools to say the last part of it again?
To target the larger contributor from car accidents and falls.
Well, we will be asking about all types of mechanisms, including motor vehicles. So as far as schools targeting them specifically, initially we would national incidence estimates, and we would be able to report from there what percentages were due to motor vehicles.
Okay, great. Next question. This is from Jennifer Lindberg. Did I hear correctly that symptoms that do not last for hours will not have them progress to injury mechanism?
No, it's hours or days. And based on specific symptoms, and actually, I'm sorry, it's not whether the symptom persists, it's time to onset.
Okay. This question is from Carrie Bennett. Will pilot data be compared and contrasted with data from the existing surveillance systems?
I think that's a great idea, and I'm sure that would be something we'd be interested to do, because we're very interested in what the difference is in the position of the data that we will collect using this system versus existing systems. So yes, that's a great point.
Right, me too. And a follow-up to that, why will disability questions only be asked of adults and not children?
I believe some of this is related to survey burden, but I can find out more specific information on that.
Okay. This is from Judy Detmer in Colorado. Are there plans for expanding this to non-sports related injuries for youth? So many of our youth are sustaining concussions outside of recreation.
Absolutely. An important part of the system is that it's not organized sports. It could be sports that are organized through recreational leagues, or it could just be riding bikes or playing with their friends. Regardless of what that recreation activity is, we'll be asking about it. So one of the highlights of the system is that it goes beyond organized sports. And then it also goes into other mechanisms, including falls, motor vehicle accidents.
Great. How many people do you intend to survey in the pilot and then after you roll it out?
Initially, the target is contacting 10,000 households. So that would allow for 10,000 adult surveys. And based on current estimates, we're thinking that we would be able to reach about 3,600 youth. So these are estimates. The 10,000, though, is definitely the goal for the households. From the larger system, that's dependent upon what we find out in the pilot. As I mentioned earlier in the presentation, we need to know approximately how many people are going to report experiencing the event so that we can have an idea of how many households we need to contact and able to collect data that's meaningful for analysis.
Okay.
The pilot will help us figure that out.
Okay. Several more questions have rolled in, so I'm just going to continue to run these past you until we run out of time.
Okay.
Did you discuss data from the National School Nurse Association? This is from Elizabeth Newland in North Carolina. I know in North Carolina we do collect information specific to concussions from all public and charter schools.
I actually did not discuss data from that source.
Okay.
It sounds like a very important source.
Mm-hmm. This one's from Linda Jones. How often will this survey be conducted?
That's another piece of information that the pilot will help us with. It depends, again, on how many people we have to contact to collect data that's meaningful for analysis. It could be every couple of years. It really depends on what we find out from that pilot information. That's a great question.
And will this be a standalone telephone survey, or will it be piggybacked onto another survey, such as BRFIS? Will it be a state-based survey?
Currently, it's a standalone. It's designed as a standalone national surveillance system.
Okay. How can we, as state TBI program administrators, support the pilot?
Well, first, we definitely appreciate the support. We're very excited to be doing this. And in thinking about specific ways, I think it's just a matter of us rolling out the pilot and then seeing what information we're able to garner from the random digit dial household survey. But thank you.
Sure. From Christina Powell, you discussed collecting data, asking if a school nurse was on duty the day of the injury. I think a better question might be, was a school nurse on duty to assess the student at the time of injury? A school nurse may have been on duty that day, but may have been off at the time of the accident or injury. Some school nurses are only part-time or cover multiple schools during one day. I think this question would gather data better. Thank you.
Thank you for the suggestion, and I will definitely put that forth as we finalize the questions. We really appreciate it. That makes a lot of sense.
Mm-hmm. From Elizabeth Wolf, from the ED data, what codes are being used to query a diagnosis of concussion or TBI? Lots of ED use the generic closed head injury code, which by definition is not concussion. Could this skew the data?
It sounds like from that description that yes, it could skew the data, and I would need to follow up to find out what the specific codes are.
Okay. One last one from John Riesler. How long does it take to get through a full questionnaire for the respondent?
That is a great question. And what we're working with now in the design and in this design phase of the project is figuring that out in terms of the different possibilities. Because if someone doesn't have a TBI, it's going to be considerably shorter than if they do. So that's one of the things we need to work through as we finalize the survey, to figure out how many questions we can ask without creating too much of a burden for the respondents. And we also have the added complexity of, if we're talking to a best reporter and they have children, how long will that get? So that's something that we're still in the process of figuring out, but it is a great question. And one I'm very interested to know the answer in.
Great. One final comment from Susan Vaughn. NASHIA is also lobbying for the $5 million requested in the budget to implement the project, and she's saying that people in the states can help to advocate for that. Good point.
Well, we're excited about the system, and we appreciate that.
And that's all the questions that are listed.
Okay.
Great.
Gary,
Thank you. Okay, sounds good. Thank you so much, Lace. We really appreciated your time and expertise this afternoon to give us more information about this, and we will stay in touch. And if there are other news bits or things that you'd like to get out to the public to let them know more about the pilot when it gets launched, we will certainly be glad to help with that.
Well, thank you so much for the opportunity today, and thanks everyone for listening and for all of the great questions.
Good deal. And just a reminder to folks, if you want to review or recommend this webinar to anyone in your circle, the recording will be posted at the NASHIA website by next week, I'm certain, along with Lace's PowerPoint slides. So you're welcome to go back and review or recommend it to someone else. And we are getting very close to being out of time for today, but we thank you very much for joining us. Please consider joining us again for future webinars to be announced later. And also join us for the annual State of the States Conference in Columbus, Ohio, which is going to be held September 12th through the 15th, 2016. And for more detail on the conference, which promises to be a wonderful one again, please visit the NASHIA website. And if you want to know more about NASHIA or want to know about joining the organization, please contact Lorraine Wargo, our Executive Director, and she'll be glad to answer those questions for you. Thank you again for joining us today, and please complete your evaluation of the webinar when it pops up on your screen. Have a great afternoon.